All right, let's talk about toxicology, the science of poisons. Now, I know that sounds pretty intense, but what if I told you that getting a handle on it is as simple as knowing how to save a sinking boat? Stick with me, because we're about to walk through a framework that's going to make it all just click.
You know, if there's one single idea you take away from all this, it's this quote right here. It's an absolutely foundational concept. Literally anything, from medicine that saves your life to, yes, even a glass of water, can become a poison if you get the dose wrong. Everything else we're about to cover builds on this one simple truth.
So let's put an official definition on it. Toxicology is simply the study of how chemicals can harm living things. At its core, it's really trying to answer three huge questions. First, what is actually causing the damage? Second, how much of it does it take to be dangerous? And, probably the most important question of all, what on earth can we do about it?
To really get how to respond to a poisoning, we're going to lean on a super powerful analogy. So for a minute, let's just forget all the complicated medical terms. Instead, I want you to picture a poisoning, a clinical crisis, as a sinking boat. Seriously, this one image is going to be our guide for the whole journey.
But hang on, before we get to our sinking boat, let's back up a step. How do these terrible situations even start? I mean, most cases of serious toxicity don't just happen out of nowhere. They usually fall into one of three main buckets. And here they are, what we call the 3 A's. First up, you have accidental poisonings, and sadly, this is really common with curious kids. Then you've got adverse reactions, which is when a medical therapy or prescription just goes wrong. And finally, there are intentional attempts, like in cases of an overdose.
Okay, so one of those 3 A's has happened, and now we are officially in a crisis. From this moment on, that patient is our sinking boat. The poison? That's the cold water flooding in, threatening to pull the whole thing under. And the goal is simple, right? Keep the boat from sinking.
So here's how our boat analogy lines up perfectly with the actual clinical actions. When we talk about supportive care, that's just keeping the boat afloat. To stop the leak from getting worse, we plug the hole. In medical terms, that means decreasing the absorption of the poison. And to deal with the water already inside, we pump the water out, or enhance elimination. See, this is our roadmap.
All right, our boat is taking on water fast. What is the absolute #1 first thing you do? It's not trying to plug the hole. It's not even starting to bail out the water. The first thing you have to do is stabilize the vessel itself.
The #1 non-negotiable first-line priority is always supportive care. Forget about fancy antidotes for a second. Forget about immediately trying to get the poison out. The very first job is to manage the immediate, life-threatening problem. The first job is just to keep that boat afloat.
So what does keeping the boat afloat actually look like in a hospital? Well, it's all about managing the ABCs: airway, breathing, and circulation. We're talking about making sure the patient has a clear airway, that they can breathe, often with a ventilator, and that their heart is pumping blood. You're basically bailing water like crazy and making sure the engine doesn't quit before you do anything else. Okay, the boat is stable. We're keeping it afloat. Now, and only now, can we start to go on the offensive. It's time to actually fight back against the poison itself with some pretty active strategies.
The first move in our counterattack is just common sense, right? If water is still pouring into the boat, we have to plug that hole. In the medical world, this means we have to stop the body from absorbing any more of the poison that's already been swallowed.
So how do clinicians actually plug the hole? Well, they have 3 main tools, and you can remember them with the mnemonic VLC. V is for inducing vomiting. L is for lavage. You've probably heard of this as stomach pumping. And C is for activated charcoal, which is amazing stuff. It basically acts like a super sponge, soaking up the poison before your body has a chance to.
Great, the hole is plugged. No more poison is getting into the system. But what about all that poison that's already been absorbed? That's the water that's already sloshing around inside the boat, weighing it down. We've got to get it out, and we've got to do it fast.
And for this job, we've got another handy mnemonic: DHH. D is for diuresis, where doctors use drugs to make the kidneys work overtime and flush the poison out. Now, for the really serious cases, you bring in the heavy machinery. H for hemodialysis, which is like an artificial kidney filtering the blood, and H for hemoperfusion, which is even more direct. It passes the blood over a charcoal filter to literally grab the poison out.
Now, sometimes you need a more specific tool for the job. You've stabilized the boat, you've plugged the hole, you've started pumping. But what if the water itself is, say, corrosive and eating away at the boat's hull? Well, that's where antidotes come in.
Think of them as the highly specialized countermeasures for very specific poisons.
Antidotes are incredibly clever little things, and they work in a few different ways. Some of them just supercharge the body's own natural detoxification process. Others act like a bodyguard, physically blocking the toxin from doing its damage. And some, which are called chelators, literally grab onto the poison molecules and drag them right out of the body. Pretty cool, huh?
So there you have it. We've navigated the crisis, we've saved our sinking boat. Let's just do a quick recap of the essential tools you now have in your brand new toxicology toolkit.
Okay, here are the absolute must-remembers. First, the golden rule, the dose makes the poison. Second, in any crisis, you always stay afloat first. Supportive care is priority number one. Third, you fight back by plugging the hole with VLC and pumping the water with DHH. These simple ideas, they really can make all the difference.
And I'll leave you with this thought. Now that you know that the only thing separating a medicine from a poison is the dose, take a look around your own home. What do you see differently? That bottle of Tylenol, the cleaning supplies under the sink, maybe even the salt shaker on your kitchen table. It's a really powerful new lens to see the world through.